Have you been wondering what is the difference between conventional medicine and holistic medicine? Maybe you're thinking like, I never want to use conventional medicine again with my pets. There's too many side effects. It's not good. I don't trust my conventional vet. Who here has been in a situation like this with their pet? Where you're just not sure conventional medicine makes you uncomfortable now because you've learned too much, or maybe your pet has experienced side effects. If that's you, today's coffee talk is all about this important topic of integrating conventional with an Eastern medicine approach. So, if you're new here, welcome. If you're returning, welcome back. I'm Dr. Katie Woodley, holistic veterinarian and founder of The Natural Pet Doctor. And I'm on a mission to make sure you, as the amazing pet parent that you are, feel empowered and confident that you have the tools, the support, and the confidence to be the best advocate for all of your pets. So if you're ready and excited to learn about conventional, but also integrating holistic, let me know. Give me a thumbs up. I know this topic can be a little bit like tense and sometimes uncomfortable, but that's why we're here to talk about it, address it, and let's go through some of the myths and the concerns around the two sides of these integrative approach. Now, here's the thing. When we're talking about conventional and holistic veterinary care, I find there's this common misperception, and I've been there. I've been there with this. This is really, really important. When we think about conventional, this is going to be really important for like your acute care, emergency care. We need the drugs. We need like the pain medications. I always use the example like if I were to get hit by a car, hopefully that never happens, but if that were to happen, please take me to the hospital. Please give me some pain medications. This is not the time and place to put me on my like the bed, the massage table, and put acupuncture needles in. That time is after the acute care where I need the support, I need the stabilization, and the same applies for our pets. Conventional medicine is really, really important for also a foundation. Now, when I say that, there's a lot of testing that's done through the conventional side that's going to help open up our eyes to see where things may be off. So that is also part of conventional. Now, we have a lot of holistic testing. We're going to talk about how to combine the two strengths of both of these approaches. But I want you to look at this. Now, holistic, I always like saying a holistic with a W. We are taking whole body approach. This is really, really important that we don't dismiss this other entire side of medicine. Yes, as a veterinarian, I was trained on the conventional side. And then through chronic illness and disease, through my own family, we had to kind of explore a different side of medicine because that's where the limitations for conventional medicine can fall short, where we're not able to fix and resolve a lot of these root imbalances because it's treating symptoms. We're using something like a pill for every ill, but a lot of people are using holistic medicine inappropriately also. And what I mean by that is that we're using an herb for every ill, and we're not looking at the true definition of herbalism, where we're looking at the energetics and what is the energetics and constitution that I'm displaying or my pet's displaying, and we're using it inappropriately, and that's where we get limited results. And so if you're using it that way, you might be there right now where you're trying different supplements, you're trying different foods, you're all over the place trying all these different things, building up a supplement graveyard. We may actually be using holistic medicine in more of like a conventional medicine aspect, if that makes sense. So we need to be able to take a step back and look at how do we marry the two together so that way we can get the best results. Now, the reason for this topic this week is because one of my amazing Blueprint members actually went through this with her holistic veterinarian. Not saying he's not holistic, right? But here's the thing. Her cat has chronic GI symptoms. They're saying it's inflammatory bowel disease, but here's the thing. There has never been any blood work done on this cat. None. And the holistic vet refuses to do the testing that she asked to be done. Now, this is a big common thing, and I'm not going to say like these people are wrong, these people are wrong, these people are right. There's ways, there's pros and cons to each side, and it's the integration that we need to look at. So, as a holistic veterinarian, I still utilize testing to identify the puzzle pieces that I need to put together to make sure we're not missing something to optimize that pet's health. So for specifically for this kitty, Mel, who's an awesome kitty, his parents love him to death, will do anything for him. They went to the vet. and they asked for the tests. And this was a veterinarian who says they're holistic. They refused to run the tests because they said it would give nothing else to the picture. And this cat has never had the test done. This is why we have these extremes on both sides. And we're going to talk about how to create a holistic, like integrative pet care plan and what you need to be looking for in your veterinarian. Whether we define ourselves as the holistic vet or we define ourselves as like the traditional vet because we don't have the knowledge from one side or the other, or maybe we don't have the ability to draw the blood, we want a veterinarian who is open to our approach and taking the holistic with a W, integrating in both conventional with the holistic side. That is the best way to approach your health and also your pet's health. And I know this can be kind of confusing, right? You're like, wait, you're a holistic vet. What do you mean? Should we like use drugs, or there is a time and a place? And that might not resonate with you, and that's okay. We still need to have some conventional medicine, testing, sometimes medications, depending on quality of life, to complement what you're doing from a more integrative, holistic approach. So we need to look at both of these different types of approaches when we're looking at our pet's care. Now, here's the thing, when I'm talking about conventional testing, and I had some what tests, well, it depends on your pet. And this is why it's really, really important that, and I see this all the time. If your vet is declining you running tests, whether they're a conventional, traditional vet, whether they're a holistic vet, we need to find a new veterinarian that wants to help find and identify the answers and take a proactive approach for our pet's care. So, your conventional tests are going to be things like x rays, your regular blood work, your annual, like preventative blood work, your CBC, your biochemistry. Thyroid testing is huge and commonly missed. Urinalysis, a cat with cystitis, they're, have bloody urine. We need to make sure that they're running tests rather than just using a drug, and even sometimes just using an herb. Because I love Chinese herbal medicine, but if your pet has, let's say, hyperthyroidism, and their thyroid is through the roof, a lot of times I'm not going to be able to just bring that down with herbs. And so we can complement the treatment to lower the dosage and support them and help other imbalances. But I need to know what's going on internally. And that is the importance and the power of running a lot of these diagnostic tests. Now, also to physical examination. Any veterinarian, whatever you call yourself, holistic, conventional, needs to be doing a physical exam to identify where things are off. Our pets, they don't speak to us. I mean, they speak to us in different ways, and you're very in tune with your pet. I know you guys, you're amazing because you're so in tune with your pets. A lot of times we can see, okay, there's something going on here. There's a difference in their behavior. They're not acting right. They feel off, and we can be the advocate for them when we go to the vet. But we want to make sure that veterinarian is doing that full physical exam because we pick up on a lot of things. I've identified a lot of things like cancer that we would have had no idea about through that complete, thorough physical examination, and then using a lot of these diagnostic tests to help provide that baseline, figure out where those imbalances are. And keep in mind, too, that conventional medicine approach, we need it. We need to have an established relationship. So if you have an acupuncturist vet, you have an herbalist vet, and that's their focus. Fantastic. Use that as your foundation, your proactive approach, but make sure you still have a relationship with a conventional veterinarian because emergencies are called emergencies for a reason. We never know when they're going to happen. They usually happen overnight, on weekends, and holidays. We need to make sure we have a place to go to bring our pets if something is happening in the middle of the night or something happens to them and you can't get into your holistic vet or they don't have the tools and the ability to be able to treat an emergency. And I can say that from a place of understanding because as a house call veterinarian, I did acupuncture. I didn't have the ability to draw blood and do like the x-rays. So I would send my patients to the amazing local veterinarian who is a traditional vet, but is open and understands the way I treat my patients. So she's not going to push vaccines and things like that on my patients or, say raw food diets are bad for them because she understands that they're doing the research, they're working with a veterinarian. And she also understands their philosophy. It is very important to find a partner where you can trust them like that. Now, in terms of holistic therapies, holistic testing. So remember, we're talking about integrating the two together to bring the best proactive, preventative approach and healing approach to your pets. Now, this is where, okay, so holistic. So there's so many different modalities. So when you're looking for a holistic veterinarian or maybe an integrative, so a vet that does both, when I worked in the traditional vet clinic, I was the integrative vet. I had the acupuncture, Chinese herbal medicine, and then I also used the conventional approach. So I used to do dentals and things like that and other surgeries. So that's an integrative approach. That's not always available, but if you can find a holistic vet to complement what your conventional vet's doing, we can do a lot of like preventative stuff and healing for those pets. So this is where there's different modalities. So a holistic vet doesn't mean that they do all the modalities. There's so many out there. So for example, I'm certified in acupuncture, Chinese herbal medicine, food therapy, so using nutrition and the energetics of food, using Western herbs, using essential oils, emotional health approaches, also detoxification. So those are the realm that I look at alongside the conventional, right? That's the beauty. I have that conventional knowledge and background to be able to complement my holistic approach. So you look for, okay, well, I really love my chiropractor. Let me find a chiropractor potentially that works on animals because I just resonate with that. So what resonates with you? And it doesn't always have to be something that you've used, but this is where looking at like the About Us page on the websites, calling them and asking them what are their specialties. And so mine would be acupuncture, Chinese herbal therapy, all the things that I just mentioned. There's going to be other veterinarians that are homeopathy trained. So not every vet, I'm not homeopathy trained. I know enough like for some acute stuff, but that's not my go-to. My go-tos are the other modalities that are still under the holistic realm. So these are important questions that you want to ask your veterinarian is, or when you're searching and looking around, what are the specialties that they use? And then does that resonate with me? Chinese herbal medicine scares a lot of pet parents and it's like kind of weird. It's like, I don't know, it makes me uncomfortable. So if it makes you uncomfortable, don't choose that modality. Don't choose that doctor that's their main modality. Because believe me, I've had clients come to me and I'm like, this is this is the therapy we want to use. And they're like, I don't know, Chinese medicine, maybe I had a reaction when you worked with someone on the like human side. And then we're like projecting that onto our pets. If you can't fully trust the modality that veterinarian specializes in, find another one. That's the thing. Like, I'm like, no worries. I want you to trust what we're recommending. Really, really important that we have a trusting relationship with our veterinarian. And so the neat thing about this holistic medicine, so that's a bit different from the conventional side, is that the holistic approach is going to be looking for like root causes. How is everything interconnected? And I always talk about think about your pet. Your pet's like this beautiful, cute little onion, and there's a root, right? That center, that core. And we have all these layers that have potentially built up around it through years of living, through like the toxins in the world, through like food, all the things that can build up, right? Vaccines, all the medicines, like we can create imbalances. And what can happen is we need to peel those layers back and it can take time. So we think about my pets had these symptoms for years and years. It's not an overnight fix. And this is where conventional medicine kind of skews our viewpoint of medicine. And we end up projecting that onto herbs and a holistic approach where we expect a change overnight. And this is where that holistic approach is working on rebalancing the body, finding those imbalances, like some of the diagnostic tests that we can do, looking at the microbiome, looking at some of the functional medicine tests. Do we have inflammation in the gut? Do we have a vitamin D deficiency? There's a lot of different tests out there that I didn't learn about as a conventional veterinarian that we can use to get a better idea of where these like imbalances, those layers are, so we can start treating and healing them versus just using something, say, like metronidazole to treat diarrhea. That's not going to treat the imbalance. It might alleviate some of the symptoms, potentially short term, but it can actually add more layers to that imbalance. This is the power of using a lot of these natural remedies and modalities, is that they're more gentle. They're working on the synergistic properties of the plant working together. Whereas with conventional medicine, we've taken and isolated one single component of that plant and we've turned it into a drug. But by doing that, we remove the protective properties of that plant. And so that's why we can see side effects with, your nonsteroidal pain medications. We can see GI ulcers, liver, kidney problems. Steroids can come with their own host of issues. So we want to be able to look at the body from a more integrative, holistic approach. Yes, sometimes we need medicine for like pain, acute chronic pain, bring that level down while we're instituting other natural healing modalities that can tend to take a bit of time potentially to really resolve those imbalances that might be present. The other piece to this holistic approach, so I'm talking about integrating conventional with your holistic, is that there is a huge mind-body connection. So who here, like, are you guys, let me know, thumbs up or comment, are you thinking about the mind aspect, the emotional health side? If you're currently going through a pet with a health issue, who here has a pet with a chronic health issue? Like, not a thumbs up because it's sad. I've been there. But, who here is going through that right now? How do you feel watching your pet not feel their best? So take a second, tap into that. How do you feel? I see you guys. I see you in the comments. It doesn't feel good, right? It's really, really hard. It's frustrating. It's stressful. You might be losing sleep at night. You might be worried. You might be displaying the same symptom that your pet has. Work with a lot of gut health pets where they have issues with gut health, IBD, pancreatitis, cats have vomiting, constipation, diarrhea. And a lot of times the pet parent has the same health problem that their pet has. The reason is that we have this close emotional connection. And there's an energetic component where we're resonating at these different frequencies. And conventional medicine is really bad at getting into that emotional health side. So yes, there is a time and a place for conventional medicine, right? But if we miss that mind connection, the emotional health connection, which is a huge pillar of health, when we talk about a holistic approach, we're going to have a really hard time healing our pets. And then it affects us emotionally. It can affect us physically. And we stay stuck in this vicious cycle of not getting to the root issue because we haven't actually addressed one of the main components. And so I always look at those 5 pillars of health, and it can be, 5 pillars of health from both a conventional and a holistic approach. Really, really important. So your physical health, your gut health, your emotional health, your immune health, and your environmental health. And we can approach it from both sides. That's the power, because when we start looking at them, we can see where the gaps and the holes are, right? And this is where we take those puzzle pieces, we put it all together, and then we're not missing something and the foundation of the house is not falling down. That's really, really important. We have an entire free masterclass on those 5 pillars. You can go to our link in our bio. You can go to our website and watch that masterclass. It's free. I highly recommend watching that because there may be something hidden within those pillars that you've overlooked or you just didn't know about that could be the key to unlocking your pet's true healing. But also, 2, it works as a proactive approach. Really, really important. So really, really important. Debbie, I see you just got back here. Tissue mineral analysis test. That is a holistic test. Most veterinarians, including myself until a few years ago, didn't even know those existed. Looking at heavy metals, looking at imbalances at the tissue cellular level versus just relying on an instantaneous snapshot of the blood work. So important. So I love that you got those results back. You've started the supplements, starting to rebalance, because that test shows us where those imbalances are rather than guessing and hoping and just trying all these different supplements. We have a path moving forward. It's our framework that this pet, even though we may not be seeing a ton of different symptoms, there's things that we need to do to help their digestion, help them eliminate toxins, help them eliminate heavy metals. Really, really helpful. I love that, someone just mentioned the microbiome test. We need to know the microbiome is key to optimizing health. We did a Better Gut Health masterclass. You can check out at thenaturalpetdoctor.com. But here's the thing. How do you create that integrative care plan for your pets? Now, this is going to involve both a conventional and a holistic approach. We still need those annual wellness exams or biannual, twice a year, if you have a senior pet. we need to be making sure we're doing a comprehensive blood work panel. And you might be thinking, Dr. Katie, that costs so much. So here's the thing, with that proactive approach, we can save towards it. So we know how much that blood work costs. We know how much that exam costs. We can put that as our foundation. Okay, I know I need to set aside this much each month. So that way I can make sure my dog or my cat or both, we make sure we're not going to miss something. Because once we fall off that cliff, right? Once we see a diagnosis of like cancer, autoimmune disease, it is much harder to climb back up that cliff. So if we can do the proactive approach, which we know what the cost of that is, we can plan for it. And then if something comes back off, like a liver value or something, wow, that liver's working a bit harder. How can we support it? Really, really important. So this is very important that we take that time to do the things that are going to help prevent or fix disease in the future. So we need that conventional vet, or if your vet's an integrative vet and does both, great. And then we have the holistic side. So this is where I see everyone talking about, the hair tissue test, the microbiome test. If you can do those, fantastic. That can be a proactive approach to make sure you're not missing something. But here's the other piece too. Like, we can train ourselves. I think someone said like they became a massage practitioner. You can massage your pets. You can put hands on. You can take care of yourself emotionally. It doesn't have to be where you go to an acupuncturist or a massage therapist or a Reiki master. Yes, those things can be beneficial and helpful, but especially if you don't have access or those resources, remember, a lot of it we can do ourselves, and we can create a healing environment, especially if we're working on ourselves in the emotional health and journaling and meditating and taking time. Your pets will feel it, I promise. So when we look at that integrative care plan, we need to focus on those 5 pillars, right? Nutrition. How can we improve that food bowl? Doesn't always mean, I know a lot of people can't feed 100% raw food diets, and a lot of pets don't tolerate a raw food diet, but how can we incorporate less processed food? That's how I want you to approach it. If we can feed 100% fresh food, fantastic, go for it. It will make a difference. But we need to be looking at nutrition. So that includes gut health. We need to be looking at the physical health. That's going to be exercise, environmental enrichment for your cats, especially, right? If you have an indoor cat, are we just letting them sleep all day, or are we engaging with them to help them? So those are key components. Who here, if you don't work out or you don't move for like a couple days, do you feel better or do you feel worse? I know I feel worse if I'm not moving, if I'm not exercising. Yes, I love that. Affection, physical health, like love, oxytocin, hugging, looking at your pets with love, right? Just even touching, like petting your dog or your cat when they sit in your lap. I always joke, you get feline paralysis. Who here has ever had feline paralysis? Cat lays in my lap. I'm like, well, Ryan, can you bring me a book? I'm not getting up. So it's very, very fascinating. When we start looking at these areas, we can create our own integrative care plan for our pets through nutrition, gut health, physical health, emotional health, environmental health, being aware of what's going into our bodies, what chemicals we're using, what's outside. Do we need to support their detox pathways? And then immune health. We're being the best advocate we can when we go to that veterinarian to help plant seeds about things like vaccine titers, asking for something different. And this is where there's so many great books to help. And two, if you have a vet that's kind of against it, they're just not familiar, they're just not aware, they just don't know, this is where gift them a book. There's so many great books from my dear colleagues, Judy Morgan, from Connor Brady, that are really, really helpful. There's so many dog and cat books out there. Gift one to them. I can tell you right now, I absolutely love reading. I know a lot of my colleagues do too. There's a reason why we went to vet school. We love learning, educating, and they're just not aware. And we don't want them to get to a point where their health has to break, or they have to go through a health ailment with their own pets to realize there's a better way. And so if we can gift them a book that's like a $5, $10 book, fantastic. Start planting the seeds. That's going to make it easier to have an open discussion. Like, I found this really interesting and helpful. I'd love to hear your thoughts on this when I come back, and let me know what your pros and cons. Let's have an open discussion about like What makes you uncomfortable? This made me super uncomfortable when I read it, and sharing that with them. So important. Yes, the Forever Dog book, Dr. Karen Becker and Rodney Habib. Those are really, really important. So keep that in mind. And for example, like I see this all the time, especially with my cat patients. They come to me, they have chronic urinary tract infections, whether it's crystals or a UTI, or we don't know because no tests have been done. So, an integrative care plan, how that would look for a cat like that or a dog, you can do dog or cat, is we need to look at the emotional health side. What's going on in the environment? Are we enriching it? Is there a multi cat household? Can we put down herbs and allow them to self select? What's going on there? Two, have we done the diagnostic tests? We need to make sure we're running a urinalysis. So we're looking for what type of crystal, what's the pH of the urine, is there blood, is there bacteria, are there white blood cells? If there are, can we run a urine culture? We need to know what type of antibiotic will actually work against that bacteria. And most importantly, is bacteria truly there? Because a lot of cats will get what we call stress cystitis, where we see blood in the urine, but it's sterile, meaning there is no infection. And the most commonly reached for drug in that case is going to be an antibiotic. And the energetics of antibiotics tend to be quite cooling. So if we have a lot of inflammation in that bladder that's creating the blood, and that's what we're seeing, that antibiotic will actually help with some of that inflammation. But the problem is that we're wiping out the entire gut microbiome and all the good bacteria and the rest of the microbiome in the bladder, which are really important for overall immune health in the body and how it functions. So we may see a general symptom improvement, but if we miss that holistic approach and we're asking for the diagnostics, we're going to end up creating more problems. And that might be why you're stuck in this vicious cycle, because now we're lacking the good bacteria. So we need to look at gut health. We also need to look at the foods we're feeding. So if we're feeding a dry food, and I'm not a big fan of prescription, we don't need prescription food in this case. And it should never be a long-term solution. Those diets have not been tested for years and years of use. They're going to end up creating a nutritional deficiency in these pets. So we need to look at, okay, well, moisture, we know from research studies, there's enough research out there. Moisture is key for these animals. So if we're feeding a kibble diet, what can we do to get more moisture in? Can we transition them to a wet food diet, a fresh food diet, even a raw food diet? Because that's going to support gut health and the rest of their body. We need to be looking at the immune system. You go in for a urinary tract infection or cystitis or some other health issue, but specifically for this example, this is not the time or place for a vaccine, especially if your vet says that they're due. This is where having a conversation saying, let's focus on the problem. And then when we recheck, we can have that discussion when they're feeling better. That's much better than saying, there's no way. Why would we do that? And it creates this horrible experience, right? And everyone gets upset and arms are crossed and frustrated. So that's being able to have that, be that advocate for your pet in that situation. And then, of course, making sure that we're asking for follow-ups, we're making sure that it's cleared up, those types of things. That's really important. So we're looking at those pillars of health, and we're able to approach it from both a conventional with a lot of the urinalysis, the culture. We have the holistic approach where we're looking at the diet, the food, the emotional health, the environmental health. We're looking at all these factors that can build up to create the symptoms that we're seeing. That's the true definition of an integrative approach, where we can combine the beauty of the pros of both approaches for the best, most proactive results for our pets to achieve true optimal health. That's how I approach every single pet. And I wanted to address this today on this week's Coffee Talk because I find that a lot of times, well, what's happening right now is we have crazy division in the vet world, right? Where we're all like hating on each other and you're like, my way or the highway, your way sucks, this way's the best. But when we actually look at the pros and cons of each, we need to be able to beautifully like put these together for the best results. So I look at, 10 years ago as a younger veterinarian, I'm like, I just didn't know about these other options. But if I had someone like you guys, where you're like, hey, I read this amazing book, by this like integrative holistic vet. There's all these research studies. Like, did you read this book by Dr. Connor Brady? There's tons of studies. I'd be like, I don't know. It makes me super uncomfortable. You'd be planting a seed. And that's where we need to take it. And if your vet is not open, because there's some out there, just like human doctors, we can't change everyone. But if you have a veterinarian who's completely closed-minded and not open to having a discussion with you about that integrative approach, we need to make sure that we're going to someone that's going to be more open. That is key. That's the key to having the partner for your pet's holistic care. And I'm talking about holistic with a W. So please, my goal for this talk today is not to convince you one way or the other, or one is bad, or you shouldn't do something. My mission for this talk is that you leave here with a more open mind, that we look at the conversations that are happening out there on social media and we invite the opposite opinion so we can have an open conversation. So that way we can enrich one another's lives and we can come together, because this movement is more important than ever. But if we can't come together to be able to hear one another's opinions, we're going to go nowhere. And it's not going to benefit our pets, and it's not going to benefit us. It doesn't feel good. So my challenge for you today is, if something feels uncomfortable, whether it's me saying something, you read something, or you see a conversation, let's invite open discussion and come at it with a learning mindset. Because the beauty is in bringing these two together, marrying the holistic with a conventional approach and coming together as a community. So I know it got a little bit like kind of weird there, right? However, I really want to challenge you to move forward with this and bring it into your own communities, your own family discussions, your discussions online. And let's come at it a place from openness, understanding, and just wanting to learn more so that we can have these discussions and we can move forward in a positive direction. So I'd love to know in the comments below what you found most helpful. Are you using a truly integrative, holistic approach with your pet's care? And I just love to hear from you. So drop a comment down below, and I will see you guys all again next week for our next coffee talk with the doc. I'm Dr. Katie Woodley, the Natural Pet Doctor. Take care.